Hello, I am Bethany Tim, and today I will be reflecting on the mental health simulation on our patient with schizophrenia. To start off, something that stood out to me was just honestly, this simulation in general is just different from anything we've ever had before. And I wasn't exactly knowing what to expect in the room, and what skills we were going to have to portray prior to simulation. Positive moments that I felt were successful was that my partner and I were fairly positive and calm throughout the entire simulation. Even if we didn't know exactly what to say, we kept pretty good therapeutic communication. There were times where I felt that we could have done less repetition of the I understand statements, just more rephrasing. But I felt that we were able to talk to our patient in a manner that didn't escalate things anymore. We were able to also do that with our body language. We respected a space for silence. I felt that we did that pretty well. We gave her time to respond to any of the questions we might have had that related to um, the doctor's orders and what needed to get done. Um, to describe how it shaped my experience of the nursing practice, I feel that not only are these applicable to the psych unit, but to any unit like med surg, ICU, that everyone deserves therapeutic communication, especially those on psych, and they are still. Everyone is a patient and deserves to be listened to and to have their feelings validated. So I feel that I learned that today, and that for those psych patients, it might just take them a little more to get there and to help reorient them. So to go into my one-on-one feedback, um, consider how this feedback will help refine your skills. So I kind of mentioned in the beginning that I missed a chunk of the mental status exam on asking about thoughts of harming yourself. And so we got creative within our debrief and we talked about how we can say it in a fashion that's not uncomfortable. And while there sometimes is no getting around the discomfort, there are ways to make it a little easier sometimes. And even just asking all the questions at once, starting with alert and oriented, getting into some of the mood, getting into the hallucinations or delusions, that would be a perfect spot for us to ask about suicidal ideation. Another thing is I use an I assure you statement. So I know going forward that false promises or any false hope is doing the opposite of what you need to do, which is build rapport with your patient. So using that going forward will be helpful. I definitely would say this did push me out of my comfort zone. I feel the same about every simulation. Um, I feel that it was hard for me to direct the conversation sometimes, especially as primary nurse and just kind of having the pressure of, oh, I need to do this, oh, I need to do this. Um, I will say any interaction with a psych patient at this point in nursing is stepping out of my comfort zone. Especially with getting up close and personal space. I've always kind of been not super comfortable with that. So that was a little bit scary, but just kind of um, figuring out how to manage that pushed me out of my comfort zone. And I feel that I can grow in those ways and that I already have been growing in those ways. Um, and in even just clinical decision making in general has always been a little pushing me out of my comfort zone. So I feel that doing simulations like Dana and my clinical experience will help me with that as well. Yeah, so I just felt that the sim overall was a great learning experience for both safety and communication of patients with schizophrenia and going forward any patient with any disorder, just to speak with them by using all of the de-escalation techniques and trying my best to validate their feelings and ensure safety. Thanks so much.